More questions? It's okay, it's a good time. So.
With the wave, the horses that have
yes.
severe waves, it looks like the bone actually conforms to that wave. Is that because...
The bone actually gets eaten away. Because when you have a wave, when that tooth is pushing on the opposing area, there's a bunch of bacteria there, and the bacteria actually erodes the bone away. Because the bone line, if you look at these teeth, that bone is there because there was a bunch of food jammed in there, and it would have caused a bunch of bacteria, so it like erodes the bone. That should have had about another 1/4 inch of bone there that eroded through bacteria. But that was a good observation that you made. So let me get the bad way about that, you will actually see the bone away. It's like even with people's teeth, if you don't keep them clean properly, you get bone loss. That happens to humans as well. How many time we probably get class?
It's 12:03, so.
Okay, we're pretty good. So that's pretty much, that's all right, no problem. You can technically 7 minutes more, so you're good.
I have a 4-year-old thoroughbred that I just got off the track recently.
Okay.
It's just project horse, but I noticed when I lifted up his lips, he's got a growth on the gum, and he's missing a tooth, and there's like fatty tissue underneath it. It's like a tumor, but he just lost another tooth, so I think he's about 4.
By 4, he should have at least 4 permanents in front and 2 deciduous caps on the side that still haven't come out.
He just lost one on the side, on the right side, and the tooth is right behind it. But there's one that's completely missing that has like fatty tissue in it.
If they get an injury to their face when they're real young, it destroys the permanent tooth underneath because it's in the development stage. And the permanent tooth is like a soft, fragile tooth. If they get like a kick in the face, like they're in the broodmare pasture, and they get a bang in the bone itself, it'll actually disrupt circulation to that developing permanent tooth, and it doesn't develop properly. The baby tooth comes out, and the permanent tooth never shows up. I have business cards, by the way, if anyone wants them too, so I should just pass it along.
And how? Please stop your question. Sorry. How old would a horse have to be able to get kicked in the face and not have damage from that? Because I have a 2.5-year-old thoroughbred, and
usually by about 16 months.
Okay.
By 16 months, the teeth underneath are strong enough that they get a trauma to it. Obviously, it can break their bones. It's bad enough, but it won't disrupt the tooth underneath.
And it'd have to be a pretty.
I had one of my own horses, one of my little minis, actually 2 of them now. Little Colt, he was like trying to get to his father because he didn't know it was his father, and they were like fighting between the fence, and it's like, you know, the rectangular wire, and he got a tooth like caught up in it and pulled the little tooth out at a year old. I know that permanent tooth is not going to ever come back in there. That's just a given because he pulled that little deciduous cap way too early. Then I have another one of my foals, and it's a similar thing. It doesn't too cool because you know the rectangular wire that you see on a lot of stable facilities. If they put their mouth in sideways, they can go in this way. If they get a fright and they turn and pull, the mouth doesn't fit this way. It only fits sideways. So they go and they're playing with the wire, and it's like stiff metal. And then if they get a fright and they pull out, as they're pulling out, they straighten their head out and they pull out. They can catch the tooth and tear it out. So it's happened to me. Minis are more prone to it because the mouth's so little. They get in between it. The bigger horses not as much because the wire isn't big enough for them to get the teeth inside it. So
there's nothing you can do, and the horse is just missing the front
one tooth, yeah. I mean, eventually all the other baby teeth will go, and permanents will come in. But with that tooth got knocked out early, the permanent will not come in. Just pull that tooth. Under 16 months, the opposing tooth is done.
But even with that fatty tissue, though, I don't know if it would be an injury, because it's not just gum, it's this weird.
Yeah, that's
I think it's yeah. What about sugar on teeth? A lot of these horse treats these days have sugar.
Oh, a little bit. It's not that. So, see, the thing with their teeth versus ours, their teeth are roughing away and grinding away. We have one tooth surface. If we get a cavity, you know, then you got to fill it. But because they're grinding that surface away, usually the teeth don't get enough chance to decay quick enough. They grind the tooth is starting to get decayed. They usually grind it away. It's ground away from wear, so it never goes deep enough. Once in a while, they get a cavity, but it's rare. Probably 1 in 200. Cavity.
I have a horse treat business.
Yeah, you can ask the sugar. I mean, you don't want to get too crazy on the sugar, obviously. We kind of limit how much is in there.
And then offhand, did you know anybody in the Central Valley, like Fresno, that does this?
The guy who I trained with, Richard Miller, he goes to Northern California. He does trips up and down that way. I mean, I would even travel to Fresno, but I would need enough horses to make it worth my while. You know, it's all relative. It's just like, Fresno's what, about 3.5 hours?
No, it's about 5.
5? Yeah, I've been in a long time. I used to compete at Ramtown, so.
Oh yeah.
Yeah, it would be about 5 hours. I drive fast, so I can make it really nice. But yeah, like I said, I would go there, but it would be a situation where, you know, we want a couple, 2 or 3 days worth of work to even make it worthwhile. We have to line up a few runs to make the trip. You know, you have my card, you can always drop me an email.